day that the Lord has made, and we will rejoice and be glad in it. I want to open up this symposium, mental health symposium today, highlighting the fact that mental health is something that is not being talked about so much in the society. People want to avoid it, both those who are affected and those who know somebody who has been affected by it. What benefit is it for somebody to be locked up in a prison in their mind when there's a key that can unlock that prison and set them free? Today, we are presenting to us just an introduction to what this is all about, because we believe it's something that needs to be talked about. I believe that mental health should not be a stigma on anybody. Like somebody said, every one of us has a mental health issue. And it's not something that the church should keep overlooking anymore, because it's happening right there in the midst of our congregation, both from the pulpit and the laity. So today, I want to welcome you to this symposium. Before I hand over to the panelists and also the moderator, I want us to have a word of prayer. I believe that God wants to fill us with knowledge. And knowing something is not going to be enough, but knowing and using what we know to get what we want. So let us pray. Father, in the mighty name of Jesus, we thank you for this hour. We thank you for this day. We thank you for this time. We know so many things are happening around the world at the same time today, but we just want to come and give you praise. We come to give you all the glory. Your word says we should acknowledge you in all our ways. We acknowledge you as the Lord over this symposium. We acknowledge the presence of the Holy Spirit that knows the mind of God. Lord, your word says you have not given us over to fear, but to love and a sound mind. Today, Lord, I pray, as we have been educated, as we have been enlightened, help us to receive sound mind, both spiritually and scientifically. We say, Lord, your name alone be glorified. I pray that your mighty righteous right hand be rested upon this, your children, that you have equipped and blessed to educate us today. Pass through them and let your name be glorified. In Jesus' marvelous name, we vow to return every praise and every glory to you. Amen. So I welcome you once again, and I want to hand over to Dr. Olurinde Oni. I know he probably will not want to toot his own horn by himself. Dr. Oni is a qualified doctor and also an epidemiologist, a clinical researcher. He has worked with Kansas City VA Medical Center. Now is connected with clinical inquiries response and a specialist in that field. I want us to welcome Dr. Olurinde Oni. God bless you, sir. I hand over to you.
Thank you, sir. It's a pleasure to be on this program today. We thank God for the opportunity to be able to hold the program. We have planned it for some time, and we thank God for making it possible for us to hold it today. I want to welcome everyone once again to this program, and we have heard so much about this mental health program for some of us who have been part of Wisdom Assembly Family Church. We probably have heard so much every time that we went live on our programs. We talked about it in preparation for today, and here we are today. God has made it possible. We give him all the glory. So today we want to talk about it. We want to talk about it, creating mental health awareness. And that is a title. And we say that we want to talk about it because people shy away. They have a tendency to shy away from talking about it. And by the time we start talking about it, then we begin to realize that it's all over the place and it needs to be attended to. Today we have able-bodied and professionals that are seasoned, they are experienced in this field of mental health. The issue of mental health, once again, I also want to let us realize that even the current pandemic, I was reading a publication where they said that even this current pandemic, COVID-19 pandemic, has increased the rate of mental health illnesses in different nations. There was a study that was done in Oxford University where they found that people who survived COVID-19 within 90 days of testing positive for COVID-19, that 20% of them, 1 out of 5 of them, developed mental illness. And that's the more reason why we need to talk about it. It has been on the rise even before now, and we have so many stressors around us these days that have the tendency to increase mental illnesses. So, like I said, we have seasoned professionals on the panel today. We want to welcome them. We want to know them before we begin to serve them the questions that we already have for them. We have here today Dr. Jide Oguntuashe. Dr. Jide Oguntuashe is a board-certified psychiatrist practicing adult behavioral health in Kansas City area of Missouri State, United States of America. He's also an assistant professor in the Department of Psychiatry, University of Missouri, Kansas City, Center for Behavioral Medicine. Dr. Oguntuashe received his medical degree from the University of Benin, that's in Nigeria, and completed his residency in psychiatry at UMKC. He's happily joyfully married with 3 children. You are welcome on this panel, sir. And thank you for making yourself available to bless the people today. We also have on the panel another seasoned professional, Dr. Kingsley Osuagu. Dr. Kingsley Osuagu is a board-certified psychiatrist. He's practicing adult psychiatry in Kansas City, Missouri, like Dr. Jide Oguntuashe. They have been working together for a couple of years. Dr. Osuagu he has several years of experience in community psychiatry. He has a lot of experience. I've actually benefited from his wealth of experience before, and I believe that he has come here today prepared with that wealth of experience to benefit many more people. I've talked to him before, and I know that he's going to be a very good resource for us on this panel today. He's happily married also, and God has blessed him with great children. We have also on the panel today, Ms. Julia Heana. Ms. Julia Heana has a Bachelor of Arts in Psychology and a Master's degree in Public Health Administration. She has worked in residential support administration for the R.S. Truman Children's Neurological Center, TNC community, where she oversaw the proper support and treatment of individuals with developmental disabilities, and at the Heartland Center for Behavioral Change, where she coordinated with counselors and other clinical professionals to improve quality of life in persons recovering from substance use. We know that with this background and experience, we have on this panel today people that have come with a great knowledge in the field that we are talking about. Through her career, she has gained ample experiences helping others cope with mental health, behavioral health concerns. Currently, she's pursuing a master's in counseling psychology with an emphasis in mental health at the University of Missouri, Kansas City, United States of America. So people, I want you to welcome these great professionals that we have here today. And without much ado, we will be going to the question and answer time. I want to also let us know that we have questions already that the panelists will be answering. But if in the course of this program you have questions as well, for some time we have been announcing that people should send in their questions, but we know that sometimes, for certain reasons, we may not have enough time to do that. But as the program goes on today, if you still have questions, you are welcome to submit them. You can submit those questions to the, you can actually, if you're on Facebook Live with us right now, you should be able to send in your questions through the chat, and we'll be watching out for those questions. If we have time at the end of all the questions we already have to feature those ones, we will definitely feature them. If we do not have enough time, then we'll keep those ones for subsequent editions of this program. Like we said, this will be the first in the series of the programs, the health programs that we'll be doing. So if you have questions, please feel free to put them on the Facebook chat, or you can submit them to the email address that we've always announced for submission. Also, the questions will be letting the panelists make their contributions, and if we have other panelists who want to contribute to any of the questions, they're also welcome to do that. We'll be going straight into the first question that we have here. And for this one, the question here is, does everyone who is battling mental illness know that this is what they are going through? At what point should a person seek help? So does everyone who is battling mental illness know that this is what they are going through? At what point should a person seek help? I want to leave this one open to the panelists. Any of the panelists can talk about this question.
I Not everyone who has a mental illness knows that that's what they're going through. Which is one of the reasons why a lot of people don't seek help because they just think that this is a phase, and that can be that can also be culturally influenced. Like if you like environmentally influenced as well. Like if you are from a place or you grew up around people who, like, maybe if you're sad, they say get over it, and you just think that maybe this is just the phase I'm going through, that I need to get over it. Like, how can I even, some people don't even believe in like being depressed or like having anxiety or having panic attacks. They just think that this is something that people should push through. Especially for like men, they would say that you can't be this and man up or something like that. So people mostly a lot of people don't know that they have a mental illness, or they struggling with some sort of behavioral problem or mental health problem. Um, when should people seek help? It largely depends. But rule of thumb for me, and this can be different for a lot of people, that's why this thing is so complicated, is that maybe you feel an overwhelming like sense of sadness or like helplessness. This is for say depression now. And it has to be, usually it's prolonged, like you've tried what you can to get out of it and you just can't do it. Like say you're normally like a happy person, or you know that movies give you joy or drawing gives you joy, and those things aren't giving you joy anymore, and you're just sad and helpless all the time, you can't get out of it. Seek help. Or if you've even tried with your, because sometimes what you need is usually around you, your family, your friends, that can help you get out of a rut, help you stop being sad if you're going through a certain situation that makes you sad. But even that is not helping, seek help. um Also, maybe like you're excessively worrying, you're like constantly on edge or panicking all the time about certain things, and maybe you notice that this is not how you used to be. seek help. Or maybe this is how you used to be, right? Some people can have this thing like from a young age. If you notice that it's like affecting your ability to function in society, those are like some of the things that you should seek help for. Um, just as long, like once it starts affecting your quality of life, once it starts affecting your ability to function in society, then ideally you should start seeking help.
Okay, thank you, Ms. Hannah. Do we have any other panelists who wants to make any additional contribution to that?
I think Ms. Hannah has, really spoken well. She talked about depression, for example. I think the key thing is, if what is going on is beginning to affect your ability to function, one can look in the direction of, example, substance use. Um, a good number of people who are using substances may not be able to um, acknowledge that that is something that is really affecting their life, and becomes a challenge to get them to seek help. Um, if your use of any substance is now beginning to affect your ability to maybe take care of your responsibilities, you're no longer able to interact with your children, maybe go to their, say, parents teachers meeting, or you're not able to go to work, or you are mostly focused on trying to look for either the alcohol or the substances, and that is taking a lot of time out of what you're supposed to do, or the person is spending a lot of time recovering from the effect of what they used, or the alcohol they drank. Those kind of things. At that point, I think the person should, seek care. Or if it comes to even a point where, like I think Nish Hannah said, you don't really see any reason to go on. You don't feel like you want to go on anymore. That is really a time to seek help. That that's my own contribution.
Thank you for that great contribution. I mean, from what we have had, it sounds to me like some of these things are things that we just take for granted, and I am sure that from our discussions today, we'll begin to pay very close attention to some of these things that we take for granted, and these are things that can potentially grow and become very major problems and issues that we be taking tolls on our lives and affecting people around us. I want to believe that participants are really benefiting from this today. I will move on to the next question. For the sake of our time, we have so much ground to cover today, so I'll move on to the second question. Where the second question here is, what is the difference between feeling stressed and feeling overwhelmed? And now I'm going to be directing that question to Dr. Oguntuashi. What is the difference between feeling stressed and feeling overwhelmed?
Thank you very much, Dr. Uni. Difference between feeling stressed and feeling overwhelmed. That's a very interesting question. In fact, just this week, I was with a group of medical students, and during that meeting, they were supposed to. I met with them online. They were supposed to come to the office to meet me, but the day before, they had contacted me, the captain of the class, telling me that they were feeling very stressed and that we should meet online, which I agreed to. And during the meeting, I started talking to them and asking them their idea of what stress means. And the responses I was getting were that, oh, I feel overwhelmed. I feel very stressed. And at one point, one of them was saying, I feel anxious. And I put it to the class, is there any other person feeling anxious? And majority of them mentioned to me that they were feeling anxious. And that was because they had upcoming projects. They had a test to do, I think the same day when we met. So going back to the question, stress and being overwhelmed, I think is just a layman's term to express how you are feeling in relation to a stressor. And most times, if somebody is saying one is feeling stressed, one should start thinking about more of anxiety than if at all one is feeling depressed. Because I think if one is feeling depressed, one can easily say that I feel sad, I feel low, I feel down. So, but you say you feel stressed, it seems to be more related to anxiety. So, in terms of differences, I don't feel there's any significant difference to talk about. But then, talking about anxiety, if I may just bring up this, I think prior to 1980, the anxiety disorders were more or less said to be stress. That is, they had this generic diagnosis saying that that is stress, and if you are having difficulty with your nerves, that was just a genetic disorder. Until 98, after 1980, they now started talking about anxiety disorders as relating to what was thought as stress. And talking about anxiety disorders, before I go there, let me just point out something, that sometimes having this kind of stress, having this kind of being overwhelmed may be a good thing. May be good in the sense that it helps you keep at bay. It propels you. Say, for example, those medical students I talked about, it drives them, to try to get that project completed. If you are feeling stressed, sometimes it might just be a good thing. But if you are feeling stressed to the point that, say, after that test they had, they are still having this anxiety, or they're having stress, and they finish the exam and they're still stressed out, then that is a problem. And talking about stress, we have a lot of anxiety disorders. That is when it becomes a problem. You start thinking about an anxiety disorder. We have a lot of anxiety disorders. Generalized anxiety disorder, where one worries excessively about day-to-day activities, about events, and one is not able to have control over the worrying. You just cannot control it. And it sort of affects your ability to function, say at your work, say at school, or you have problems in your relationship. You have problems in the family, you can't really relate with them, you're avoiding them, or you may have another disorder. And talking about that, you also have what I call some other symptoms associated with that. And that is what people tend to experience when they're having stress, like physical symptoms, like you're having, say, for example, insomnia. No, physical symptoms like restlessness and problems with your sleeping. You feel fatigue, or you have muscle tension, such that you might be having tension in your back or in your neck, and then you probably be having headaches, or you just feel very restless. Psychological symptoms, you just feel restless, keyed in. Those are symptoms that one will have when they're having stress. But then, if these symptoms persist, they go on constantly, say over 6 months, you're still having all the symptoms. You talk about genital athletic disorder. We also have some other disorders. I don't want to. I think for the interest of time, let me just stop here for now. Thank you very much.
Thank you, Dr. Mutuashe. Participants, I'm sure that you agree with me. We have a lot to do today. We have a lot of resources that panelists have brought to us today. From that contribution, I mean, one of the things that I learned is that, well, there is still a positive side to being stressed, as long as it doesn't get out of control. There is still a positive side to being overwhelmed, as long as it propels you to take a positive action. And then once that action is completed, then the stress, it goes. But by the time that action is completed, maybe you are stressed because of, or you're anxious about an exam that is coming, and then it propels you to begin to, to put in hours in reading, studying for the exam. Then after the exam is gone, then that stress should be gone. That feeling of being overwhelmed should be gone. But if that feeling continues after that, then you need to seek help. And that's why it's okay to talk about it. We'll move on to the third question. How do we bring this topic to the awareness of our children? How do we talk about it? How do we talk to them about it? And then what are some early signs of depression and anxiety? This question will be directed to Dr. Oswago.
Thank you, Dr. Oni. In trying to address this question, one has to ask also the question, which topic are we wanting to bring up with our children? So it will be, if we know what exactly is going on, then that will be helpful. But I'm going to look at it from the perspective that whoever is involved with the child, if it's the parent or if the family member, has already noticed some things in that child. And we are talking about seeing maybe that child having some symptoms of mental illness like the depression or anxiety. So that's the angle I'm going to look at it from. So it will be good to have a conversation with your child to tell them what you've observed. Say, for example, your child is someone that is happy, always going, wants to go out every time things are being done at home. You notice that the child is beginning to, isolate, likes to maybe be in their room, not really talking much during family gathering. Or you notice that the child is, kind of worrying or is a little bit irritable, then to have a conversation with your child to, kind of ask them how they are doing and find out what is going on in their life and educate them about what you found out. And this presupposes that you actually know about the symptoms of mental illness, because it is at this point that you'll be able to say, I think you need help, or I think, we need to watch this. So it still comes down to you, the parent or the family member or a friend, knowing actually what to look for. Because if you know what they are, then you'll be able to provide help or bring it up. I think most people know, for example, if a child is having an asthmatic attack, most people will know with breathing difficulties, you will ask your child, oh, I think you need to use your inhaler, or depending on how it is, you may say, okay, you need to go and see a doctor. So it would be good for either the care provider or the family member or friend to know what are the symptoms, which brings me to that question of what are the early signs of depression or anxiety, or the other mental illness. But maybe we can stick with just depression. If a child, you can make an observation of your child that they look sad. That's an early sign. Or the child tells you, for example, that they feel down or they feel depressed. That's an early sign. Or you notice that, you know, the child is not eating. The child, like I said, is withdrawn. The child is not able to pay, focus. Um, or sometimes maybe the person may start talking about, they don't feel like they belong, or they don't feel like, the people care about them. Some of those things can be things pointing to possibly this child, has some symptoms of depression. Of course, you are not going to be the one that will make the diagnosis, but you could see some of the things that will help you to say, okay, I think this person needs to get help. Let me talk to a mental health professional. You are not going to be the one that will diagnose your child. Or you notice a child that likes to go to school, suddenly they'll start giving you an excuse that they don't want to go to school. That can be, you know, a reflection of some kind of anxiety or something that's going on in their life. Or, or they'll bring up some things that they have abdominal pain. This is, I don't want to go to school today. I need to see a doctor. Those can be things that points to something else going on in their life that could, um, in that, there's some kind of anxiety, or that, maybe they will say, okay, I want to study from home. I don't want to go to school. You can then ask them questions, what is going on? Maybe they'll be able to share with you what they think is going on. Um, it is when you pick up on some of these things, um, like Dr. Jide talked about also, maybe the person is very irritable, they are not sleeping. That poor sleep can be from depression, it can be from anxiety. Um, or you see a child that was doing well in school, suddenly the child is having poor performance in school. You need to ask what is going on. It could be from either depression, it could be from anxiety, it could be from what is going on. Maybe they are being bullied in school. So having a conversation with your child can help you begin to identify that. Some that can be very obvious is if your child is beginning to use alcohol or, or drugs. Maybe you can see the telltale signs. Or maybe your child begins to talk irrationally or begin to interpret things going on in the environment, giving it some interpretation that doesn't really make sense. That can be, maybe they're becoming, psychotic. So a little bit of those can help you. Maybe it's okay, I need to ask someone who knows more, because not everyone that has these things I'm talking about, you can say, okay, this is really what they have, but they just have some of the symptoms. Then you need to talk to a professional who can help you clarify what is going on and tell you, okay, maybe this is what they think is going on. Maybe this person needs to, you know, um, engage in treatment or not. That's my own contribution.
Thank you. That was a very great contribution. So parents that are here with us, one of the things that Dr. Osuagu talked about, he said, when a child when a child says, I want to stay home and study at home rather than go to school today, and that's a good time to start a conversation to ask them what is going on. Let's not think that, okay, all is well. Maybe today they just want to really stay home and study hard. maybe there is more to it. I will go to the fourth question. The fourth question will be going to Dr. Oguntoashe again. There are many who take medications to help them with all the different side effects that come with medication. Should a person by all means avoid taking medication? Does medication actually help? Sure that question is, does medication actually help mental illness?
Thank you
Dr.
very much.
Mutuashi.
Thank you very much, Dr. Oni. Talking about medications, side effects, I should say, are the most common reason why many patients do not want to take medications, or even when they start taking medications, side effects are one of the reasons why they discontinue their medications. But I have to tell you that in fact, all medications do have side effects. Do you want to talk about Tylenol or paracetamol? If you take it, say for example, you are treating maybe back pain, it can cause nausea, it can cause vomiting. It even has very serious side effects like anaphylaxis, which is an emergency. So you should know that all medications do have side effects. Vitamin D, over the counter, also have side effects. You can go and check it. So the consideration here is that when you have side effects, that should not deter you to consider medications for a start. But then, when you present to the clinic to see the psychiatrist seeking medications, we don't just throw medications just like that. You know, we are having a mental illness and take medications. Yeah, we do evaluate you, and we do have other options. We would consider, at least for a start, if depending on your mental illness. Say, for example, you present with depression. Yeah, we can offer you psychotherapy. You know, you can do that before you start considering medications. Just like when you go to your primary care for treatment, the primary care is going to offer you different options, discuss it with you, and it's also left to you to decide if you want to follow what option you want to do. But then talking about side effects, I want to point out that even if you are having side effects to any of these psychotropic medications, many of these side effects are short-lasting. In other words, you start taking a medication, maybe say for an antidepressant, perhaps in the first week, you probably may be having nausea, vomiting, headaches, and after more or less your body gets used to it, those symptoms disappear. And sometimes some of these side effects are treatable, you know, can counteract the effect of one medication that's producing side effects with another medication. You know, if you're having side effects, you know, I think I think people tend to get discouraged about what they've seen from maybe in the past when people were given antipsychotic medications, psychotropic medications that they feel very sedated, they look like zombies, and they feel psychotropic medications are bad. That's not necessarily the case. Right now, we have new medications that are effective, safe, and tolerable with minimal side effects. So there are various options right there to consider in terms of if you're scared about taking a medication because of its side effects. But the other part of the question, that does medication actually help? Well, I would tell you from my own experience, Dr. Oswagu will also tell you from his own experience categorically that yes, these medications, they work. Now, let me just um, tell you about the scenario. Okay, say for example, you see a patient who is manic. Manic is one of the features of bipolar disorder. You present manic, that is, you very hyper talkative, you probably sleep only 2 or 3 hours, and the next day you are full of energy and you just want to keep going, clean your house, mowing your lawn, or you become impulsive, whereby you may just go online and start just shopping with your credit card, just like that, you know, and you're just full of energy and you can't seem to slow down. Like your mind is just racing 100 miles an hour. You can't seem to slow down. You see a patient like that in your house, you know, first day, second day, and it's just going on like that. I'm sure you will want somebody to give that person something to slow that person down. Medications seems very effective in that case, or maybe a psychotic patient who is agitated, you know, may become violent. What do? Are you just going to be staring at that person like that? You have to give that patient something to calm that patient down. So medications are very effective for mental illness. Or for example, if I use the case of a schizophrenic patient who is on an antipsychotic and he decides to go off the medication, you know, doing okay and goes off the medication, you find out that not immediately the patient becomes has a psychotic break, not immediately, but with time, 3-4 months, the patient is going to be very psychotic. Why? Because the patient went off medications, and it is always more difficult to treat then by the time the patient presents like that. Thank you.
Thank you for shedding light on that, on those questions, Dr. Ogunto Ashe. So I just, for the sake of those who joined us after we started this program, we announced at the beginning that we already have some questions that we are going to be addressing. But if you have questions, I think maybe as we go on in this program, as we listen to some of these contributions, some questions may be coming up on our minds. Let's feel free to put those questions. Let's post them on the Facebook Live. Let's post them there for those of us who are connected on Facebook Live. And for those of us who still want to send in our questions after the program, we have that email address that we have announced for some time now that we should send our questions. Feel free to do that, and we will definitely look for another opportunity to put those questions together if we are not able to fit them today. So I'll be moving on to the next question, and this will be I would like two of our speakers to be talking about this one. Ms. Hannah will be talking about it, and after that, Dr. Osuagu will also make his own contribution. It says that there are many who have committed suicide, and people closest to them have said that they didn't see the signs and didn't know they were struggling. What are some signs that people might miss? So first, I would like Ms. Hannah to talk about this.
Thank you. Signs that people might miss. Well, there are a couple of signs that people might miss, especially today. One thing that I know this is talking about death and talking about dying is something that people would see usually as a red flag. Immediately someone talks about it, oh, like I want to die. Like when they say that, it's like, oh, what's going on? But lately, especially in the youth, talking about dying has become somewhat of a more, it's become part of like the pop culture now. It's more so because of, well, the way the economy is, and there's a lot of blame to be passed around, and the way things are in general. um Someone can easily just say as a joke that, oh, you know what, I just want to die, I'm tired of like living on this planet and everything. And one thing we know is that in suicidal clients, they can also say that jokingly, they can say that laughing. So it kind of makes it difficult. But if you know someone who talks like that or says things like that, whether or not you believe it's a joke, it'll be best to always check in with that person, just to kind of make sure. Because if it ends up not being a joke, then of course that becomes a problem. But I just thought I should put that out there because that's supposed to be an obvious sign, right? But it, with the way things are now and the way it's being used, that term of, you know what, I just want to die. Oh my God, it's it can be easy to miss. Now, for things that are normally not obvious, I would say sometimes emotional distance or like isolation. Sometimes it's not even, you don't even have to be isolated from your friends. Like if you notice your friend is isolated from you, yes, that's a sign. But sometimes it's not even just that. Like they're just emotionally distant. They're not as, close to you as they were before, or they're not as expressive. They're really like emotionally withdrawn. Then rather than seeing that as just okay, personality development, because people can tend to like, um, modify the personalities as they grow. But you also want to make sure that if you notice something like that, you want to check in with that and express that you're there for that person, or do any other thing that you feel like needs to be done. Like if it gets to the point whereby you feel like you need to intervene and be like, yo, like what's going on, and just check in with that person with regards to suicidal thoughts, because that's something that people usually miss. Also, actual physical isolation, like if they're no longer coming out anymore. Some people can tend to see that as, you know what, they just need their space. Maybe they're going through, especially when it's after they've gone through something like maybe grief, or loss, or some sort of significant, overwhelming change in their life, and they begin to isolate themselves, even physically. You don't want to like just leave that up to, oh, they need their space, right? We have phones now, we don't always have to like go physically and be there. Like you can always call them, check on them, make sure that they know that okay, you're still there for them and all that. But that's another sign that people tend to miss, because they're like, oh, these people, they probably just need their space, they don't want to be around. And there are people like that, yes, but just to be on the safe side, because that's something that people usually miss. uh what else? I would say in general, like any general changes in behavior from like what they usually, um, from how they usually act. And this can be going from somebody that's outgoing to becoming someone that's not, or someone that's not outgoing becoming someone that's outgoing. Like you just want to check in with that, just to make sure, because that's another thing that people tend to miss. What else? That's usually like the ones that usually like stand out to me as things that people tend to miss. Um, or yeah, that's usually the ones that tends to stand out to me as ones people tend to miss. The other ones are like kind of obvious, uh, but I would say rule of thumb, like any unusual changes in behavior that what you're not, and it's extended. That's something that you should be looking out for, like as a warning sign.
Okay, thank you for that contribution, Dr. Oswagu.
Thank you. I think I want to, you know, go back a little bit to talk about medication, if it's okay with you. Um,
That's okay.
um, uh, the reason also I'll kind of reflect that in terms of, suicidality. Um, so the question says, by all means, should medications be avoided? I don't think by all means medication should be avoided. And like Dr. Jide pointed out, medications do help. Um, One has to look at the quality of life of the person without medication. So even with the side effects that can come with that treatment, what will be the quality of life of your family member, your friend, your child, or if you're the provider of your patient, if they don't get treatment. So you have to balance that when you're making decisions. Um, like Dr. Oguntuashe said, we don't always go to medications first. Of course, there are situations where that will be the first option, especially when life, is the risk of one losing their life um, is there. Then you may need medication as the first line. First of all, um, things like ADHD, there are behavioral protocols that you can use. First of all, to see that your child may be able to, focus and do their work in school. But you also have to consider if you don't treat the ADHD, for example, that child may start doing badly in school because they are not able to focus, they are not able to concentrate. So in the long term, it triggers down to what is going to happen to them when they grow up. They may end up not functioning at the level they're supposed to or achieve, maybe the goals or things they would have achieved if they got treatment. Of course, not everyone with ADHD will need medication. In terms of suicidality, with mania, like Dr. Jide talked about, there are some impulsive behaviors that could actually lead to someone dying, either intentionally or unintentionally. So you may need to provide treatment for that person. Um, and also, with psychosis, also, like you said, somebody may be um, so distressed with what is going on in their life at that point, they will make decisions that maybe it wasn't really what they intended to do, but they may end up, losing their life in the process. Or the decisions they made over time without being treated can lead to them becoming homeless, for example, or losing their job. So, things starts, trickling a little bit, that not being treated may lose to homelessness because they don't see the need to either pay their rent or even some of them might go off, they don't eat because they don't see the need to eat. Uh, then the person becomes homeless or they don't go to work. So while if there was treatment provided, maybe that person will be able to stay housed, keep their job. So you have to consider all these things. Even with depression, some people, when they are depressed, they may stop eating, start losing weight, start feeling hopeless, and sometimes feel that life is not worth living and might get to the point where they want to take their own life. So you have to consider all this. It doesn't mean you have to give medication all the time, but there are times you really need to provide psychopharmacological intervention. I think, Ms. Hannah has really spoken a lot about, signs that people can miss in terms of someone being suicidal, withdrawing from family members. There may be changes in behavior. Maybe that person becomes more aggressive, or they may tend to start using drugs, or their use of drugs escalates. And some people self-harm, they start cutting themselves. Those may be, um, things to look at. The person becomes more impulsive, or, they start, you know, talking a little bit about death and things, talking about a lot about death or people dying. Or someone can make the comment that, maybe that no one will miss them or they will be better off, maybe the family will be better off when they are not here. So don't take those things for granted. Kind of um, talk to them more about it. And like she said, talking about suicide doesn't make it worse. It's good to talk about it with either your friend or your family member, just, to know where they are at, and so that you know if there's need to intervene. Thank you.
Thank you, Dr. Osuagu, for that contribution. And that's why it's okay to talk about it. That's why we have this symposium today, to create awareness and begin to talk about it. One of the things Ms. Hannah said that, it's so interesting that, some people, it's very common these days that people will say, I need my space. I need my space. I need my space. So it may not all be that simple, that they just need their space. It may be something that is more serious than that. And we may need to listen to them, and maybe they need help. Thank you for those contributions, Ms. Hannah and Dr. Osuagu. I'll be moving on to the next question, and this one is very interesting because we all know that people have, somebody has a flu and they recover from flu. Someone has a headache, the headache goes. But this question says, can people with mental illnesses recover completely? I will direct this one to Dr. Mutuashi.
Thank you, Dr. Oni. So like you rightly mentioned, somebody who has a flu can recover completely, or who has headache likewise. And it also goes to mental illness. There are, I would say, a good number of mental illnesses that one can achieve full recovery. There are others that you may not be able to achieve that full recovery, but you may be able to improve the quality of life to the point that they are able to stay functional. Now, mental illnesses, let me allude to depression. And the Dr. Osuagu have talked about depression, and there's some of the symptoms. Depression itself comes in varying severity. You could have mild depression, moderate depression, severe depression. Severe in the sense that you start thinking about suicide. You may be having psychotic features, hearing voices of people talking to you that are not there, or seeing things other people can see, or you may be having delusions, false beliefs, thinking that you are worthless, the world is against you, kind of negative thinking in depression. But talking about mild depression, even severe depression, moderate depression, you can recover fully to your baseline prior to when you had that problem. Now, talking about an illness like schizophrenia, that is one of the mental illnesses, and I can liken it to a disease like diabetes or hypertension. If you ask somebody, can you recover fully from diabetes or hypertension? No, not really. You may not be on medications, but if you're not doing what your doctor tells you to do, that is, you're not doing the necessary lifestyle modification and changes, you can come down with your blood sugars not being controlled. The same thing with schizophrenia. If you are taking medications, yes, you might get to a point whereby your symptoms are in remission. In other words, you are not symptomatic at that point, or you might just be symptomatic, but it's not really causing any significant problems in your ability to function. So it depends on what that mental illness is. There are mental illnesses that one can fully recover. There are some that you may not really fully recover, but that doesn't mean that you are not able to have a good quality of life if you perhaps following what your providers are telling you to do. Thank you.
Okay, thank you for that contribution, Dr. Oguntoashe. So from that, I think the take home is that there are some that people may not completely recover from. Not that they will be having symptoms, but they just need to be on some medications, and those medications will keep them would keep the disease under control. But there are a number of mental illnesses that people recover from, just like many other illnesses. So then the next question will be to Dr. Osuagu. What are some of the causes of mental illnesses, and are they preventable?
Thank you, Dr. Oni. Can everyone hear me?
Yes, we can hear you.
Okay. So I still want to maybe add a little bit to what Dr. Oguntoashe said earlier on.
Okay, please go ahead.
Can everyone hear me? I think the internet is a little bit slow. Okay. So like he said, sometimes people can fully recover from an episode of a mental illness, but sometimes if they have it of first time, second time, third time, if it becomes recurrent, then maybe you're looking at it more as a chronic illness that needs to be addressed with both medication or maybe psychotherapy. I also want to use, point to some physical health concerns. We don't know who is going to come with mental illness and how severe it's going to be for that individual. The same way, like he said, some people can become hypertensive, they lose weight, they make lifestyle changes, they wouldn't have elevated blood pressure again. While some people will require 3 or 4 different pills to keep their blood pressure under control or their diabetes under control. So some people may have the mental illness in a more severe form that it becomes chronic in nature and they need care consistently going forward. So that will be my my take in that. Somebody might have just an episode of anxiety, they do psychotherapy, learn some coping tools, and they wouldn't require any other interaction with a mental health provider. In terms of the question you asked, the causes of mental illness, there are several things that has been noted that can be associated with mental illness. It can be someone's gene, just like in physical health. Somebody, they might ask you, do you have a family history of hypertension or diabetes when you go to see your primary care? And that's because they know that some of these illnesses, having that in your family kind of increases your risk. It doesn't mean you're going to have it, but it means that maybe you need to be more cautious of it, or somebody needs to start doing colonoscopy earlier than others because they have a family history of colon cancer, all those things. So genes can predispose somebody or make them more susceptible to developing mental illness depending on the type. um, Environmental factors also, um, or things like drugs, alcohol. um, it's been noticed that some type of infections that can happen during when somebody when they are pregnant with that person can be associated with mental illness. So um, those are some of the things, to keep in mind in terms of mental illness. And of course, the area where, most of our medications come in is, the neurotransmitters like chemicals in the brain. It's been observed that, some either deficiencies or overproduction of some of them, or even sometimes some changes in the brain structure can be associated with mental illness. Um, there may be situations where it's a combination of all three um, that is playing a role in that. Um, I would think, for example, if you already have maybe a family history of mental illness, or maybe specifically maybe for psychosis, um, avoiding things like, cannabis, for example. We know, there have been studies out there that followed some people over the years, and they found that people who smoked cannabis were more likely to develop a psychotic illness. So maybe you can, work on not doing that. That can help prevent it. Things like, drinking alcohol. Alcohol is a depressant. After someone has drank it for a while, it affects your physical health and also cause your mental health. So avoiding things like that can help. And also doing things that will lessen the stress, maybe exercising, um, not engaging in things that may uh, predispose you to stress. I mean, we all know about uh, most of us, at our work, we are told to be mindful of when maybe we think we are working too much, know when to be able to take time off so we can be able to relax and and not get ourselves overworked, because that can also uh, produce, kind of trigger what could happen. That can trigger you to having a mental illness. Knowing that, say, some life changes, very stressful life situations can predispose somebody who has already that gene to become develop some form of mental illness, um, to developing it. Um, so working around those things that will promote healthy lifestyle can help prevent some of them. Um, uh, thank you.
Thank you, Dr. Osagu, for that great contribution. Some of the causes of mental illnesses that Dr. Osagu talked about, I know that maybe many of us, many of the listeners, participants may not be doing those, may not be drinking, we may not be smoking cannabis, but one that is very striking is the issue of stress. And like he said, that's one of the ways to prevent mental illnesses is to look at those stressors and see how we can avoid them and at least reduce those stressors. I want to believe that we are all learning from these experiences of professionals today. We'll be going to the next question, and this one will be handled by Dr. Oguntuashe, and this is like a follow-up to the previous question, the last question that Dr. Oguntuashe answered in regard to whether people with mental illnesses recover completely. And so the next question is, do people with mental illnesses have to be on medication for life?
Thank you,
Doctor. Okay.
Thank you, Dr. Oni. Thank you very much. Let me just add one or two points. to what Dr. Osoagu was saying about some of the causes of mental illnesses. Yeah, he talked about the genetic factor being predisposed to that illness, or environmental factors. There's this other part too, whereby can lead to stress, which he talked about too. But there's what we call the psychological factors, which you find occurring, especially in early childhood, that some along the line they eventually develop a mental illness. Psychological factors like abuse. Abuse is a very big one. It could be physical abuse. It could be emotional abuse, verbal abuse, or even sexual abuse. Yeah, those are pretty strong factors that could predispose someone to develop a mental illness. I think, like I said, it's multifactorial. There's really just no one cause that can lead to a mental illness. It's just multifactorial. But anyway, just to answer your question, that do people with mental illness have to be on medications for life? I think that we depend on the kind of mental illness we are talking about. There are many mental illnesses that even sometimes too, you don't even need to be seen by a provider to fully recover, and you don't even need to be on medications. But there are a good number of them. Let me use depression as an example. I think Dr. Oswago talked about that briefly. You may have an episode of depression and you fully recover, you become fine, and you're able to go about your normal life. And in your lifetime, you may not even have any single episode of depression again, But then, Dr. Saku talked about that it could be recurrent. You may be having recurrent episodes of depression affecting your quality of life, such that you may not be able to function. In such case, if you have had at least 2 episodes of recurrent depression, maybe had one last year and you had one this year again, it's recommended that you want to be on medications. You want to be doing psychotherapy for as long as you can to at least help improve your quality of life. An illness like schizophrenia, which has a lot of biological basis involved, you have to just be on medications most of the time, especially when it is chronic. You have had several episodes of psychotic breaks. You just have to be on medications for life, if I may say so. And why medications? Why do we have to just medicate somebody just like that? You find that people who are medicated, it's not as if medication itself is preventive. You are taking medications, you have schizophrenia, you have depression. It doesn't say me that you're not going to see, you can't still come down with an episode. You can. But should you come down with an episode, it's not going to be as severe being on medications. And it's going to be easier to treat. They say there's a decreased length of stay of hospitalization if somebody comes down with a mental illness when medicated. So you have a shorter time of recovery whenever you take medication. So like I said, it just depends on the illness that we determine if you need to be on medications for life. And sometimes too, being on medications itself is not as if the providers don't do anything about the medications. We tend to make adjustments. We tend to go down if you are doing very well. The purpose is just to try to give the least amount of medication or the least dose that will be effective for you. And sometimes too, you can be taking medications, like I said, depression, which is recommended to be on if you have had recurrent episodes. But sometimes too, along the line, if you have developed good coping strategies, yes, we might just take you off, observe you closely, and maybe maintain treatment through psychotherapy. But you just have to have something in place to help. Thank you.
That was a great contribution. I actually wanted to chip in an addendum to that question, and I was so happy that panelists just addressed the question. I wanted to chip in. I wanted to ask whether it's possible for people to start with so many pills and then to go down to fewer pills, so that at least people can feel better, and we can begin to allay the fears about taking so many pills. But our panelists already addressed the issue of adjustment in the medication. So thank you for that contribution. I want to also remind the participants that the chat is open for us. If we have additional questions, we want to send in through the Facebook chat. I already have one question, and if we have time at the end of all the questions we have here, we'll be happy to treat those questions to feed them to the participants. We'll be moving on. We've spent so much time, but I believe that this is a time that is well spent. We are learning a lot from our panelists today. I'll be calling on Ms. Ehana again for this question, and then Dr. Osuagu will contribute to it. I think we have addressed the first part of this question a little bit, so I want to say that we emphasize on the second part of it so that we can begin to conserve our time today. So the first part says, what are some of the warning signs of mental illnesses? And like I said, I think we've addressed that pretty much. So the second part is, how can the community help such individuals? So Ms. Ehana, your contribution.
Thank you. How can the community help such individuals? Well, first of all, you need to not downplay what people are going through and make it seem like it's because not everybody passes through the different. I mean, as counselors, we refer to a lot of mental health conditions as transitional phases, especially if it's not like severe illnesses like schizophrenia or dementia. But not downplaying that as something that, you know what, you should just get over it, or give it time. You'll be over it, or you'll be done with it. You go through this phase. If somebody is constantly giving you signs that they're going through something emotionally, or they have some sort of mental health concern, rather than make it like something that make it look like they're being weak-willed, or they're not being strong enough, advise them to seek help. For example, substance abuse. So this is a very interesting one, because a lot of people just think that, okay, if you're drinking, right, if someone tells you you need to stop drinking, right, that should be the end of it, and you think that just because you've yelled at this person, they'll suddenly, you know what, I'm going to stop drinking. That's not how it works. When it comes to things like substance use, there's actually like a part of the brain that it affects and makes you dependent. I mean, it's alcohol dependency. You're dependent on it now. So it's not like you can just say, oh, stop drinking and you were like, oh yay, I'm gonna stop drinking. That's not how it works, right? So you can't just downplay it, and you can't make someone look like they're not strong enough because they are finding it difficult to stop drinking. This goes for many other mental health disorders. You can't make it look like, oh, you're just being weak-willed. You're not strong enough. Or even as Christians, right? We shouldn't say that, oh, because this person is depressed, um, they're not, their faith is not strong enough. That's not what it's about, right? This is about a chemical imbalance in the brain. This is about an actual illness that they're going through and they need help to go through that. So don't, it's a matter of not downplaying. What the community can do is not downplay people's conditions and situations just because they're not processing it the same way we are. So say if somebody lost their dog, right? We can't say because, oh, we don't feel that strongly about dogs as part of the family that we're just going to be like, oh, why are you crying over that? Or why are you isolating yourself now because you've lost your dog? For some people, that dog has become like their anchor. That dog has become a part of the family and it's become like emotional. It's become an emotional support animal, right? We have emotional support animals. So just because that's not the situation for you doesn't mean that you should condemn your friend or condemn somebody that you know because they're not processing it the same way you are. So that's something they can do. Another thing is to make sure that if you notice actual signs of mental health concerns, um, make sure you're always like advising the person to actually seek help. Um, a lot of people sometimes don't actually believe in like the suicide hotline or the mental health hotline. Um, but that's actually a very good resource because it's not just you're not just calling a hotline and talking to someone. Sometimes it can actually refer you to additional resources that you need, right? So making sure that you're asking people to like seek help, and if you have the means to help that person research these resources or find these resources, help that person to do that because they might not always have the access to those resources or the means by which they should find these resources. So yeah, those are kind of the things that you can just, and what I would say is just if someone is going through something, try to be there for them rather than, and even if you can't be there for them, make sure you're not condemning their situation or make sure you're not being overly judgmental about what it is that they're going through. That's just what I can say that the community can do as a whole. It goes back to, how we had to change from viewing individuals with disabilities. We had to have like a whole act because they were being discriminated against from getting into jobs because they believed that they couldn't function. But it's not a matter of them not being able to function. It's just that there wasn't like enough. There weren't like enough facilities to help them function. Right? It's not something they can control. So it's just the same thing. Just make sure we're not condemning people's mental health conditions. Making sure that if at all we can be there for them, then we should be there for them, and always advocate whenever you can. That's what I would say. Thank you.
Okay, thank you so much. So let's be there for them as families, as a church, the communities. Let's be there for them. Dr. Oswago.
Thank you, Dr. Leander. Thank you, Ms. Shehana. I think Ms. Shehana has really touched on this. Um, I think being knowledgeable about mental illness is important. I said it earlier about, we are very good at knowing symptoms of physical illness and how to intervene. If we have a family member who is diabetic, we can easily say, oh, don't eat pastries because we know it will cause elevation of blood sugar. So if you have a friend or a family member that has mental illness, kind of either going to the appointments with them, trying to know a little bit more so that you know how to support them and being able to know some of the warning signs that maybe things are not going as good as it used to be, so you can help them get the appropriate help they need, is important. And of course, if there's concern for safety, trying to um, get them to get evaluated quickly, trying to help them if educate them on what is going on. If you see that maybe they are beginning to isolate, ask them questions, what's going on. If you notice they are not eating, for example, kind of talk to them. Um, if they are seeing a mental health provider, maybe make out time to go to the appointments with them, encourage them to, you know, um, take their medications if they are not on medication. Maybe if they are doing therapy, kind of encourage them, keep an eye on what they are doing so that they can, uh, you know, be consistent with their follow-ups or what, is recommended for them, because that will help them. Most times, let me not say most times, sometimes people with mental illness don't follow through a lot. That can come from the, point of not really understanding, maybe the severity, or they are not wanting to acknowledge it. We call it insight or something, um, or even with like substance use. Um, like Julia said, shaming them or telling them you have to stop is not going to work, especially over here. So, or you see someone who is smoking cigarette, you say you need to stop smoking. They have had that many times in their life. So you have to come at it from a different angle and walk, meet that person where they are and trying to encourage them, letting them know that, you're there for them, and, being able to show that you support them, not that you're judging them, and that will help them actually trust you more to open up, especially when things are going south. So knowing that even with their, the challenges or the ups and downs in what is going on, that you are not judging them or you're criticizing them, like Dr. Guntuashi has said, you know, part of one of the things that can predispose to mental illness can be a negative, environment. You grew up in an environment where you're being criticized, people are already telling you so many bad things. Then they have had enough of that. So finding a way to kind of, work with that person, and not judging them and criticizing them, that can help. Um, and of course, from our own perspective, the church, um, asking that person to, work with their spiritual leader or talk to their minister, the pastor. Uh, in, 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 in psychiatry, one of the strong factors you look at is, faith. Faith is a very strong protective factor, in terms of mental illness and risk. So trying to build on that, that person's faith, and helping them to walk, with their ministers, or, the pastor, knowing that they have someone, who can talk to them, pray for them, and, encourage them to still, hold on to their faith, because that is really very important. That, can help. Thank you.
Thank you so much for that contribution and for actually emphasizing on the fact that faith can help, and we are people of faith. We have resources, spiritual leaders that we can talk to. Let's feel free to talk to our spiritual leaders, ministers, heads of departments in our church, in our different ministries. Maybe we have here people who are not members of Wisdom Assembly, in whatever ministry that you are calling from. You have spiritual leaders there, so feel free to open up to them. There will be great resources so that we can begin to deal with these issues that are affecting our lives and affecting families, affecting communities. God will help us in Jesus' name. We'll be moving on to the next question to Dr. Oguntuashe. Why is it important to identify and treat mental illnesses early?
Thank you very much, Dr. Uni. So the question is, why is it important to identify and treat mental illness early? You want to consider some of the causes that predisposes one, or factors that predisposes one to a mental illness. Let me go back to that, to the early psychological factors. Maybe like Dr. Osago was saying, that you are verbally abused growing up, or physically abused. That's we do that a lot back home, in Africa, where we're from. We get a lot of physical abuse, or physical discipline, but sometimes it goes to the point that it becomes physical abuse. I mean, imagine, I remember when I was in secondary school, and we used to have what we call detention. For every Friday, they call us out if you've offended, and the principal or one of the teachers we whip you with a cane, and you receive marks on the back. You can't tell me that is discipline. That's physical abuse. And I mean, a lot of teenagers, of course, we know are molested. The girls, even the guys. So these are I mean, just factors that, if not addressed early, if you don't have psychotherapy, I think that should be more effective as a form of treatment at the early stages of children, teenagers who have suffered this kind of trauma. So if you don't address it, maybe by psychotherapy, they are more prone to developing mental illnesses like PTSD, post-traumatic stress disorder, depression, anxiety, or even substance abuse. And I know Dr. Osagu talked about ADHD at the beginning. I know a lot of parents, they're not interested in wanting their kids to be medicated, but talking from personal experience, I've worked with kids in the classroom before I got into residency. I see these kids, how they are when they are not medicated for their ADHD. They're very hyperactive, they're very impulsive, they can't focus, they're just all over the place. But then you give them that medication, and they're a different person entirely. You can even tell when they don't take their medication. They're able to stay focused, they're able to do their work, and eventually they have good grades. Most of them are very smart kids, and eventually you find them that later in life they are successful. But as a parent, you feel that, oh, I don't want to medicate my kids. I'm just going to just let it be. You find that these kids, they eventually may drop out of school, and that drug or that medication drug that you didn't want to give to them when they needed it, later in life you find out that they are going to be abusing drugs. They're going to perhaps be taking there's this medication called methamphetamine. It's just like the Adderall, the Ritalin that we give for kids for ADHD. That is what they're going to be using because it's going to be working for them. So it's very important that we can intervene early, identify these kids, intervene very early. Then the other mental illnesses. Let me use schizophrenia for example. Usually schizophrenia, when the patient or the individual starts becoming psychotic, that's usually around the time they're about to finish high school or in the early stages of college, later, a little bit later in females. That's when they begin to become symptomatic, if they are going to be predisposed, if they have those genes, this predisposition to developing schizophrenia. But there's been research that shows that if at that time you see these kids start becoming symptomatic. They start having maybe the delusions, the withdrawals, the avoidance, it's just a very good time to start medication. You may think it's too early, but it's very good to start medication at that particular time. And that's because the medication itself that you may be able to start, I don't want to become a bit scientific right now, but if I may just put it like simply, those medications prevent subsequent episodes to occur. And in schizophrenia, we have what we call the how do I put it? Okay, we have what we call the stepwise decline in functioning. In other words, if you are not medicated, you begin to have psychotic attacks on and off. We are losing brain neurons. You are losing brain cells, and you have cognitive impairment, such that you have difficulty focusing, difficulty thinking. Whereas if you start someone early with medications like that, you prevent those breakdown of those neurons in your brain. I mean, so put it that way. There are many medications that are said to be neuroprotective. So that's why it's very important. You have to intervene early, and sometimes we have genetic testing. Whereby you can even determine sometimes if an individual might come down with a mental illness like schizophrenia, and you might be able to just intervene as quickly as possible. But one other important issue I must have to add here is people with mental illness, they tend to have a higher mortality and mobility rate as compared to the general population. And what I'm just trying to say is that people with mental illness, they might be okay. They don't have any physical symptoms, no physical problems. They're just okay. But later, some of these medication side effects have side effects that can cause them to become diabetic or weight gain as a side effect. But then, when patients like this have a mental illness, say for example depression, and they have lack of motivation, they don't want to leave their house to go get themselves treated or go for appointments with their primary care, because of their depression, and they may be having a condition like diabetes, but sometimes too they just withdraw and they don't get that help that they need to get, and that's why the mobility rate goes very high. They tend to avoid to get that necessary help. They're out of medications, they are just depressed, lack of motivation. They can't pick up the phone to call their primary care provider to refill their medication, or they don't keep their appointments, or maybe you have an anxiety disorder, there's a condition they call agoraphobia. You tend to avoid going out into open spaces. You can't seem to function well in large crowds. You just tend to just stay behind and don't go out to say go get your go for your treatment. So that's why they tend to have a higher mobility, which eventually they develop complications from medical problems, and that might lead to death. So basically, it's very important to try to treat, not necessarily medications. Therapy is okay, and if they get to understand their illness right from the beginning, and they see the benefit of psychotherapy, they see the benefit of medications, it's likely that they tend to be compliant in the long run. Thank you.
Thank you, Dr. Ashe, for that great insights. People, you notice that these panelists are loaded and they can continue talking on and on these topics, because that is what they do. That's what they do, and they are so knowledgeable about these matters. I know that we are gradually running out of time, but we still have a few questions that we would like to let our panelists answer before we go. I also want to appeal to our panelists for the sake of time to help us to. I know that they have so much to say, and talking to them before this meeting, they were like, "Oh, there's so much to say on these questions. So how do we compress? Let's try and compress so that at least we can answer the questions that we have before we go today." So I'll be going to the next one, which is going to be answered by Dr. Osuagu. Like one of the panelists said, I think maybe said Dr. Osuagu, that many of us we are from Africa, that are most likely many of us connected to this program right now. And we know that in Africa, people tend to go and find out what is that family like before they marry in that family. Sometimes they'll say, "Oh, do they have people with mental illness in that family?" That kind of thing. So this question is, do mental illnesses run in families? I think it's very appropriate for our setting today. Dr. Osuagu.
Yeah, thank you, Dr. I just want to say one or two things about the previous question. The bottom line is early intervention will prevent a lot of some of the comorbidities that is associated with mental illness. We know that depression, I think, costs say US alone, the burden that comes with depression alone costs US government billions of dollars in time, in terms of a lost time lost, going to work. Then some people might end up needing support from the government. But if you intervene early, it could help not let it get to that point. There are a lot of professionals in different fields that have mental illness, and they're able to work very well. My position is because they sought help early. Of course, there are situations where people come down with mental illness in a very severe form. We can't predict that, but intervening early, like you said, someone in college starts having what we call prodromes of schizophrenia. You might chalk it to saying, "Oh, they are being lazy, they are not, they have started smoking weed," you let it pass. But that will lead to the person maybe not graduating college, staying home. While if you intervene early, maybe that person would have graduated, got a job, and be able to, work in the society, own their own, apartment or house, and get married. But the longer you stay, the more difficult it might be for you to get them back to where they should be. And of course, if you don't intervene early, the other health problems that might come with, mental illness could, come into play also. If someone is depressed and they have diabetes mellitus, even before the depression, they may not see the need to take their medication for diabetes. So they can now develop the complications from diabetes, the end organ damage, kidney failure, heart problems, neuropathy. But if the depression is treated well, maybe they will have the motivation, the energy to want to address the other health issues. So coming to mental illness, I think I said it earlier, one of the predisposing factors is genetical, just like in so many other health conditions. But it doesn't mean that that person is going to get it. You may or you may not. It increases the person's risk of having, a mental illness, depending on the type of mental illness that, a family member has. Um, it's the same way if you have, family history maybe of heart disease or colon cancer, they want to screen you early, want to work with you to make sure if it does happen, you can get early intervention and not develop the complications. The same thing with mental illness, being aware of that, and then taking measures that will help you, one, maybe not develop it, or measures that will help you to actually seek help and, get the care you need. That's good. When you talk about the culture in Africa, that speaks to the stigma that, is associated with mental illness, which is very more back, in Nigeria or Africa. And that is why people don't want to be open about mental illness. But there is treatment for mental illness as there is for other health conditions, and people are able to, function well if it's addressed properly. Thank you.
Thank you, Dr. Osagu. It's very enlightening. I will be moving on quickly to the next question, also to be addressed by both Dr. Osagu and Dr. Oguntuashe. So first, I would like Dr. Oguntuashe to talk about this one. If someone is showing warning signs of mental illness or actually develop mental illness, but they are denying it, how can we help them? Dr. Osagu,
Thank you.
Dr. Oguntuashe first. Sorry.
Yeah, thank you, Dr. Oni. I think a lot has been said at this point about some of the things that we can do to help people that have mental illness. But I think it boils down basically to one has to be very supportive of them. And I'm happy that we are having this kind of symposium, creating awareness, being educated about some of these common mental illnesses, so that at least as an individual, you may be able to understand what your family members or somebody that is close to you who has a mental illness is going through. So we have to be at least aware and be able to show empathy, be able to be non-judgmental. But then I don't want to. I know we're almost. I know we're running out of time now. But I think the big thing here is if a patient is having difficulty or is in denial about the mental illness itself, you want to take a situation or a scenario. Say, for example, somebody is very, very, very depressed, gets to the point like you are not eating, and then you are thinking of harming yourself. That's severe. And what you can do in that case, especially in this environment where we are in, you can, as an individual, maybe as a family member, file out an affidavit, that is just a written report about your concerns, about the dangerousness, about the patient, that you feel the patient is suicidal and might hurt himself or herself. You can fill out an affidavit, and the psychiatrist or the provider can use that to be able to commit you against your will involuntarily. Or a situation whereby you are just so sick, maybe you're psychotic, you're just so sick that you are not eating, you maybe eating from the trash can, you're just so sick that you can't just take care of yourself at all. You can also fill an affidavit for that. And with that alone, the patient, even though they are in denial, we can always intervene to help the patient. Thank you. Let me just stop here.
Okay, thank you for that answer, Dr. Osagu. Let's hear from you briefly on that question.
Yeah, I think.
How can we help?
Yeah. Thank you, Dr. Thank you, Dr. Oguntuashe. Um, if there is concern for safety of your family member or your, you know, patient you're working with or a friend, I think reaching out, you know, you can even call the crisis line yourself and say, this is what I see going on. How do I proceed? They can advise you on what to do, or, you know, completing an affidavit, um, and, you know, getting them the care they need. But otherwise, if it's not that severe, you know, being supportive, trying to let them know that, you know, they are not alone. They are not the only one going through it. You know, mental illness is very common, and getting them maybe into some support groups where, you know, they can talk with other people that are going through such mental illness might help. Um, you know, that denial brings to my mind what happens in some African countries where people tend to maybe present mainly with physical symptoms. You know, we call it somatization. They just complain of pain here and there, but instead of saying, okay, I'm depressed or something, you know, that, and it's still part of that stigma, you know, to say, okay, I have depression, for example, or maybe there's, you know, another form of mental illness going on, but they'll feel more comfortable talking about their physical complaint, which maybe is acceptable to the society. You know, being able to maybe pick up on that and also being supportive and maybe educating them on what you think might be going on. Of course, you won't be able to make the diagnosis, but asking them, you know, can we go see your primary care doctor? Some people feel comfortable going to see their primary care doctor. That might be the first port of call than going to see a psychiatrist, and um, or getting them to see a counselor, or, or you know, or the pastor, spiritual leader. That might be also, you know, a way to help while they are beginning to, you know, either gradually acknowledge what is going on. That might be what will help even with, you know, resolution of the symptoms. Thank you.
Thank you, Dr. Osagu, for that contribution. For the sake of time, the questions we have, I believe they have pretty much been addressed. One is about resources available in the community to help people with mental illnesses, and I think we've stressed that so much. And the other one is about the advice we have for people, especially for adolescents and young adults, on the issue of suicide, which has already been addressed as well. But before we close for today, I want to throw this question that came during the program. I want to throw it to any of our panelists that would like to talk about it, and briefly because of time. And that question is, why is there increase in depression during winter?
There's a couple of reasons, but the major one is it's actually biological. The lack of sunlight is for a lot of people, that lack of sunlight, like it affects, like it kind of regulates the way your body produces neurotransmitters, which neurotransmitters for anxiety and depression, and it kind of regulates your emotions regarding that. So that lack of sunlight not being there, because like if the sun is out, it's bright and everything, but if that lack of sunlight biologically, it affects you from being able to, it affects the way your body produces those neurotransmitters for that, for let me use layman terms, for joy and depression and anxiety and all of that. That's one. Another reason can also be situational. So the winter time, especially in this country and in a lot of countries, is where we have those holidays. We have Thanksgiving, we have Christmas, we have New Year's, and all of that. For people that have recently lost someone, or not even recently, people that have lost someone, those holidays can actually be sources of, rather than joy, it can be sources of sadness for them because they no longer have those people that they usually share these holidays with. So it's a constant reminder that they don't have these people anymore, and then they fall into a state of depression. So that's another reason why people can get depressed during the winter time. So those are my two, and in case the doctors have any other additions to why people get depressed during winter.
Okay, that was wonderful.
Yeah, I'm not sure if there is a whole lot to add, and time is not on our side. But I think with the winter period, there comes also social isolation. Um, People don't go out that often because of, you know, for those who go out to interact, go to bars or whatever, those things are no longer there. But what also has to keep in mind, you know, it's difficult to diagnose. That's what is called seasonal affective disorder. So it may be what is going on, but you have to, you know, see the person and figure out if that is what is going on. And, you know, the things that Mr. Hannah talked about, you know, is also true. And I'm gonna end it there.
Okay, thank you so much. And I want to thank God for making this symposium a success. I want to thank the Almighty God for all our panelists that God has prepared, and they have been so resourceful to us today. I thank God for your lives and thank God for how you have made yourself available to bless us today. God Almighty, we reward you mightily in Jesus' name. All our participants, thank you for coming out today. I believe we now know so much. Now that we are aware, we can begin to talk about it. We can begin to address these issues, and we can begin to take actions to help ourselves, to help the families, to help communities, to help anyone around us that might be going through these issues. It's time for us to take action. I want to hand over to our Father in the Lord, Pastor Kalawansin, for the closing charge and prayers. Over to you, sir.
Praise God. What a wonderful time. Knowledge overload. That is what I'll call it. We from the African origin, we need to understand that from everything we've heard today, there's no reason to stigmatize somebody with mental illness. Personally, I believe each and every one of us, we have a dose of it from everything we have heard today, because we all go through one change or the other in our lives. Situations come, life throws us a curveball. We have pressure here and there. I've shared before during one of my preachings how twice in my life, many, many years ago, about over 30 years ago, twice I was driven to committing suicide because I felt so overwhelmed. There was so much pressure on me as to how do I approach my future, my life. I was just coming out from a very challenging situation. Even though there was nobody there to talk to about it, but by the grace of God, the Spirit of God helped me. Today, the issue of faith has been mentioned as part of the help that is needed to resolve or to help when somebody is going through a mental health episode. The promise of God for us to have a sound mind cannot be overemphasized at this very time. And the more of the word of God we are able to put in our hearts, the more of the presence of God we are able to carry. And that does not discountenance the professional health of people like the doctors on this panel today, whom God has used so much to educate us and to bless us. Counseling is so effective, whether in church or seeking a professional psychiatrist who will help to get anybody go through that funk and get out of that funk. Another thing mentioned is that we as a community of people in the church and as a and in the family, we must be there to help. If we don't understand what somebody is going through, we shouldn't downplay it. I'm sure we have heard this. Because you don't understand my feeling doesn't mean my feeling is not true and doesn't mean my feeling is not important. So husbands need to try and get to understand the emotions of their wives. Parents need to get to understand the emotions of their children, and friends and vice versa, all over the place. Let us be our brother's keeper. People in your sphere of influence, check out on them. Find out how they are doing. And I believe that there's an iota of help in each and every one of us. Praise God. The church has a responsibility, and God will help us as a church to help people go through this situation. Another thing is, a problem shared is a problem half solved. Don't keep your challenges to yourself. Talk to somebody. Talk to your friend, talk to your parent, talk to your pastor, talk to your head of department. Talk to somebody in your school. If you're unburdened, that is less stress. But if you keep it to yourself, no matter what your situation may be, you need help. Always seek help. I have a couple of pieces of information here, like a National Suicide Prevention Lifeline. If you are driven to such a point, please call 1-800-273-8255. 1-800-273-8255. And anybody also can download an app that is called, I just researched that today, an app that is called my MHCP, my MHCP app. And that is something that can help anyone who is going through a mental illness situation. It connects you to somebody immediately. My MHCP app, whether on Google's Play Store or on the Apple Store. Finally, I want to say a big thank you to our panelists. I appreciate you so much for your time and the dissemination of knowledge on the issues relating to mental illness today. You have brought quality and intelligent discourse to the open, and we've just scratched the surface. Like we said at the beginning, like our moderator said, Dr. Oni said, this is the first of many. I believe that we are going to be holding and other symposiums on different other issues, not necessarily mental health issues. We'll be coming with symposiums on the issue of finance, symposium on issue of investment and whatnot and other things. Thank you so much. We can see that information on the screen, National Suicide Prevention Helpline. Praise the Lord. Dr. Jide, I'm so grateful. Thank you so much for your time, your intelligence. Dr. Swago, I'm very grateful for your time, your intelligence. And Miss Julia and Hannah, thank you very much for your time and your intelligence. And lastly, Dr. Oni, thank you for a well-moderated symposium today. For me, it has been extremely excellent. And without much ado, I also want to say thank you to all those who have been part of this broadcast today. I believe that you have gotten something. And if you have any question, please go back to Wisdom Assembly Live, Wisdom Assembly KC@gmail.com. Send us whatever the questions may be, and we will send it back to this panel. They will be able to answer those questions. And also, I want to say thank you to our technical department for a fantastic and a wonderful time. May I remind us, our Sunday service tomorrow morning, it's going to be exceptionally a wonderful and a blessed time. May God bless you all. May God increase you all. May the hand of the Lord rest upon you all. May God give you all sound mind and the love of God take over your life in Jesus' mighty name.